is very important factor. This is again a social factor. If people are literate, qualified, they are going to adopt the healthy lifestyle. Yeah, if ladies, गांव की ladies थोड़ा सा उनका education का level होगा, they will come for the institutional delivery rather than home delivery. फिर healthcare access, social context, that is very important. That is also the one of the social you can say determinants of health. Social context में क्या आता है कि आपका सोसाइटी में लोगों से कनेक्शन कैसा है. यू आर पार्टिसिपेटिंग इन द वेरियस इवेंट ऑफ द सोसाइटी, मतलब यू आर इंटरमिंगलिंग विद सोसाइटी. that reflects your mental health also. If you are mixing with the people are with you, they understand you, you understand them. So that kind of social bonding in the social context, that also helps you. फिर healthcare access is, that is also one part of it. Sometimes you don't have healthcare access. आपके पास पैसा भी है, सब कुछ है, but you don't have social care access because of may not be facility, may not be available, remoteness, transport facilities. They are also that part of things. फिर आपका जो नेबरहुड का जो इन्वायरमेंट है, that is also a part of, that is also one determinant of this social factor. नेबरहुड का एनवायरनमेंट, आपकी लिविंग कंडीशन आपकी खुद की कैसी है, आपके अगल बगल में पानी कहाँ से आ रहा है, whether it is coming from some authenticated source or something like that. सेफ्टी का क्या आपका इंतजाम है, और जितने आपके यहाँ तार के कनेक्शंस आ रहे हैं, वो बिजली के कनेक्शंस आ रहे हैं, they will not lose wires or something like that, which can invite the some kind of potential harm to the community people. फिर बहुत सारे इन्वायरमेंटल कंडीशन है, मीन्स आप हिल स्टेशन पे जा रहे हैं, आप हिल स्टेशन पे जा रहे हैं, आप हिल स्टेशन पे जा रहे हैं, आप सोशल डिटर्मिनेंट ऑफ हेल्थ. एंड यू मस्ट रिमेंबर, until unless you are not addressing पब्लिक हेल्थ में ये सारे फैक्टर हमें एड्रेस करने पड़ते हैं. देन ओनली यू आर एबल टू प्रोवाइड योर this healthcare facility to all. Social relations will very very important. Later on you see in the community जहाँ पे हम पेशेंट सपोर्ट ग्रुप वगैरह बनाते हैं for treating or for dealing with the disease, वहाँ पे बहुत important है. The things which are in the 2002. And if we talk about the objective primary healthcare approach, that was the same with the 1983 decentralized public health system. That is again the already it has been done. Convergence of which government launch. Okay, तो वो सारा एक नेशनल हेल्थ प्रोग्राम के अंदर में आके इट इज सपोज टू बी बीइंग इम्प्लीमेंटेड इन ऑल एरियाज. उसमें दो सेंट्रल गवर्नमेंट एंड देयर आर फ्यू हेल्थ प्रोग्राम विच द नेशनल आल्सो, मतलब सेंट्रल आल्सो. So that is also kind of program, national health program. Public health services को स्ट्रेंथन करना, कई जगह ह्यूमन रिसोर्स नहीं था, बहुत दिनों से देयर वर नो काइंड ऑफ रिक्रूटमेंट ऑफ द डॉक्टर्स और द पैरामेडिकल स्टाफ. वो सारा कुछ नहीं था, वो करना. प्राइवेट एंड एनजीओ सेक्टर को उनको भी लूप में लाना, सो दैट दे कैन ऑल्सो give some kind of support to the community in terms of the health. A lot of NGOs they are working that. If you see in the field, Piramal, बहुत सारे, I cannot take the name, so much of name, Sarthak, lot of NGOs they are working in the field of this healthcare. Same time, government has to increase the percentage of GDP on the health. Till date, Indian government they have GDP approx. They are using just 1.5 something like percent of GDP on the healthcare, which was very low. At WHO का जो criteria है, that is more than 2.5%. WHO told कि in the lower middle economic income countries, if we are not able to spend the more than 2.5% of GDP on the healthcare, healthcare is not going to be improved at all. मतलब no significant change will be there. So that is one part which actually in India that is not. And उसका reason है because we are the most populous country. It is very difficult to spare or the dedicate so much of money for the health. So for that, we have to take the different approach, but still India is continuously they are increasing their some portion of the percentage in the GDP. Not very significant, but definitely there is no decline. At least we will we can be happy कि there is no declination in the percentage of GDP. So roughly 1.52% GDP you can say percentage of GDP that is being increased incurred in the healthcare expenditure. And with that only we have to promote all these kind of activities. Then there are few key elements, that is one of the financial resources. वेरी इंपॉर्टेंट कि पैसा पब्लिक हेल्थ में कहाँ आ रहा है, अब कहाँ से आता है। एक तो गवर्नमेंट आपको देती है, फिर देर आर फ्यू सोशल हेल्थ स्कीम जहाँ पे आपको पैसा कंट्रीब्यूट करना पड़ता है, वॉलंटरली कंट्रीब्यूट करना पड़ता है, विच इज नॉट वॉलंटरी, इट इज अ कंपल्सरी काइंड ऑफ थिंग। देर आर फ्यू एग्जाम्पल्स ऑफ द सीजीएचएस, ईसीएचएस, जहाँ पे यू हैव टू गिव मनी कंपल्सरी एंड यू गेट द इंश्योरेंस, दैट इज कॉल्ड ऑफ सोशल इंश्योरेंस। फिर देर आर सम प्राइवेट काइंड ऑफ इंश्योरेंस, वो कंपनियां आती हैं जहाँ पे आप वॉलंटरली पैसा लेते हो। फिर जो फोर्थ वन जो कैटेगरी आती है वो आपकी आउट ऑफ पॉकेट एक्सपेंडिचर आ गया, जो आप अपने पॉकेट से देते हो जब आप ट्रीटमेंट लेते हो। फिर कुछ ऐसी चीजें आ गई जो बाहर की कंट्री से एज ए डोनेशन आती हैं आपके पास, कि वर्ल्ड बैंक वाले ने पैसा दे दिया। फिर कुछ चीजें ऐसी हैं जो एनजीओ सपोर्ट करते हैं आपको। तो दीज आर ऑल द फाइनेंशियल रिसोर्सेज जहां से हेल्थ में पैसा आता है, हेल्थ सेक्टर में पैसा आता है। तो वी हैव टू अंडरस्टैंड ऑल दीज थिंग्स। हालांकि दिस इज ए वेरी सेपरेट टॉपिक फॉर द हेल्थ economic, but these are the basically financial resource. And equity, lot of things has been told on the equity. There are two words you should never forget. One is the equity, one is the equality. Equity word is mean कि if you need two vaccine, you are supposed to, you have been given two vaccine, and other people he needs only one vaccine, so he should be given only one vaccine. Means whatever the requirement is there, then only it is not like that कि सभी को पकड़ के दो वैक्सीन लगानी है तो सभी को लगा दो। So that is not equity, that is equality. So in healthcare or the public health, we should always focus on this equity. So this word is very important. You should always, you should not forget to use this word in the public healthcare at least, even in the private also. फिर नेशनल हेल्थ प्रोग्राम की डिलीवरी, स्टेट ऑफ पब्लिक हेल्थ इंफ्रास्ट्रक्चर, लॉट ऑफ वर्क हैज बीन डन। पब्लिक हेल्थ सर्विसेज को एक्सटेंड करना, जैसे आयुष्मान सेंटर, इनिशियली इट वाज नॉट देयर, आयुष्मान सेंटर वाज देयर, सिटी में भी नाउ द अर्बन center they have been open, all that kind of thing. Role of local self government institutions, I told कि this पंचायती राज एंड ऑल दैट, जहाँ पे आपको सरपंच, मुखिया, इन सारे लोगों को आपको अपने उसमें शामिल करना है। फिर इंडियन मेडिकल काउंसिल एक्ट भी उस समय थोड़ा सा इनहेंस हुआ। एजुकेशन ऑफ हेल्थ केयर प्रोफेशन, लॉट ऑफ हेल्थ केयर प्रोफेशन इम्प्रूव फैसिलिटी। उसके बाद पब्लिक हेल्थ एंड फैमिली मेडिसिन, दिस केम इनटू द एग्जिस्टेंस। पब्लिक हेल्थ बहुत पहले उतना, इट वाज नॉट बीइंग सो मच गिवन इम्पोर्टेंस, और इट वाज नॉट being very much emphasized. That nowadays this is the only the public health. Same time nursing personnel also, nursing council, they have been restructured, reorganized to providing the nursing services. More focus on the generic drugs rather than this branded drugs. As if you just analyze or if you see some research and all that, whatever the expenditure on a patient happens in the hospital, approx 50-60% cost of that treatment that is pertaining to the drugs only. So that is why government has taken this step for this generic drugs. Urban health, as I told you, कि there were urban communities and health centers, they have been opened over 1 lakh population. So these are the few things which has been included in this 2002 national health policy। और मेंटल हेल्थ के ऊपर फोकस हुआ, इंफॉर्मेशन आईएसी, स्कूल हेल्थ के ऊपर एम्फेसिस दिया गया 2002 में। एंड it is all continuous. School health now, it is very important to have some kind of basic medical establishment or the medical care at the school at all level। Health research के ऊपर lot of now the various hospitals they are coming up, and government they are tying up in the remote areas for this public private partnership also, okay। प्राइवेट वालों के साथ मिलके गवर्नमेंट दे आर प्रोवाइडिंग दिस फैसिलिटी। डायलिसिस इज वन वेरी बिग थिंग व्हिच आई हैव सीन इन द मेघालय आल्सो। आई वेंट टू द मेघालय फॉर सम assessment of the district hospital। वहाँ पे डायलिसिस का जो फैसिलिटी था वो इट वाज अ वेरी रिमोट एरिया, मतलब खतरनाक रिमोट एरिया इट वाज देयर। बट अपोलो वाला दे हैव एस्टैब्लिश्ड देयर डायलिसिस, एंड पीपल वर टेकिंग द डायलिसिस at very reasonable cost, मतलब in that remote area। So that kind of public private partnership that is going to be very helpful in that remote area or the tribal area। फिर national disease network surveillance network has been created, lot of ICDS and all that portal has been created, where every facility has to report the disease incident, so that you have some sufficient kind of data, and later on whatever the policies are being made, they are supposed to be implemented. data driven or the evidence based kind of thing. Health statistics पे जोर दिया, that is again the talk about this data. Women's health with lot of thrust has been given regarding this reproduction health. लॉट ऑफ जनरल शिशु सुरक्षा योजना, बहुत सारी फैसिलिटीज है जहाँ पे इंस्टीट्यूशनल डिलीवरी के लिए some monetary things are added. Medical ethics, lot of medical ethics in the field of the public health, that is also being extended. Enforcement of the quality standard for food, drugs, and even the healthcare facility also. NQAS is there. FSSAI for the food and drugs, that is also supposed to be implemented in the public health. फिर पैरामेडिकल का जो स्टैंडर्ड्स है, उनके जो स्टैंडर्ड के क्राइटेरिया हैं, दैट इज आल्सो बीइंग सेड. लॉट ऑफ थ्रस्ट वाज गिवन इन द एनवायरमेंटल द एंड द ऑक्यूपेशनल हेल्थ. द person who is working in the agriculture, the person who is working in some kind of factory or some kind of occupational exposure which cause cancer or some skin diseases, वहाँ पे इस टाइप के प्रिवेंटिव एंड द प्रोमोटिव big thing which was just creeped or the increase in the 2002 onward, कि India now become the center for this health tourism, and the government they are helping to create the environment for the health tourism in the India. As we as our treatment is a very quality treatment, same time we are very cost effective treatment. मतलब our cost is far far less in the other countries, and quality is there is no question of doubt. Indian medical care or the Indian healthcare delivery quality is superb kind of thing. And particularly Chennai, and after this Chennai, you can say the NCR, they are the hub of this medical tourism. Biggest center is the Chennai, where the lot of hospital they are just JCI accredited, and they are international kind of facilities they are providing their hospital. The Chennai is the top on that, and then we can talk about this Delhi NCR region, where the lot of health tourism is there. Okay. Now after this 2002 policy, as you see कि 2002 में बहुत सारी चीजें include की गई, lot of things are included which are going to benefit the public health. But again, after this 14 years, you see change is a continuous kind of thing. Change is one thing which is the most permanent in nature. That is a kind of quote कि what is the most permanent thing, that is the change होना ही होना है. तो वैसे ही same thing healthcare sector में भी there was significant change come. And now government and the public health consultant people they start realizing, you know, we have to make some kind of changes in the existing health policies. And why that changes are required? The first is the health priorities are changing. Now the present days, if somebody is working कोई public health में कहीं काम कर रहा है, with lot of thrust is giving on the maternal and the child mortality. These are the two things which are still problematic for the India. Still we have the maternal mortality rate is on higher side, and child mortality rate, infant mortality rate is also on the higher side, which we are supposed to decrease. Okay. तो ये एक बड़ा फैक्टर है जो चेंज हो रहा है, बट स्टिल वी हैव लॉट ऑफ प्रॉब्लम इन दैट एरिया. एंड सेकंड, now the burden of the non-communicable disease, NCD, that is the hypertension, diabetes, or brain का severe disease, any kind of thing, which are non-communicable disease, उनका भी load बढ़ रहा है. Everybody is knowing now the younger people they also become hypertensive, they also become this diabetic because of the lifestyle change, the kind of lifestyle they have adopted, working in a metro cities, running for their jobs and all that, and they don't have any kind of time for them for mental, some kind of mental peace or some kind of health activity for them. So these increase in the non-communicable disease, this is also the one factor which makes the public health personnel realize or the country realize to get some changes required. Second important thing, if you see, lot of private hospitals they are coming at, and they in couple of years they are just flourishing like anything. Matlab, if you see the take about this Medanta and all that, our Medanta owner Naresh Trian, he is now in terms of the money he is a big billionaire kind of person. His name is in the list, top list for this money and all that. So now this corporate culture is coming up, and a lot of people, their economic condition also improved. Second, we talked about this insurance sector also. Insurance sector also, that sector is very much blooming, and because of that, now everybody has some kind of insurance from some agencies or something like that. So insurance is also one part which makes the people to spend the money on this healthcare sector, and where the demand is there, मतलब लोगों के पास पैसा है तो definitely they want some good health and all that. तो जब डिमांड होगा तो देर आर मार्केट में पीपल हु वांट टू सप्लाई द थिंग, दैट इज द इकोनॉमिक प्रिंसिपल कि यू हैव टू try to balance the demand and the supply system. Okay, still India is the most populous country, that is why demand is not being met appropriately, and because of that, treatment in the Indian context I am talking about, I am not comparing with the developed country, but in the Indian context, kind of country which is considered as a developing country, still the treatment in the private hospital is on the very higher side. And ये कोई नई चीज नहीं, everybody knows this. Same treatment in a nursing home you can get it. Minor operation, suppose cholecystectomy है, गॉल ब्लैडर निकालना है, एक छोटा नर्सिंग होम उस सर्जरी को 30 से 40 हजार रुपए में कर देगा. But if you want to get that surgery into the Apollo, you have to pay 3-4 lakhs. Well, 10 times or sometimes 5 times rate difference in the. I am not denying that there is no difference between the quality or something like that. But if you see the outcome, it is only the cholecystectomy, gallbladder removal. Okay. अब कितना पैसा आदमी क्वालिटी का ले रहा है, that is not being standardized in the India till date. That is the biggest seller. Every hospital they have their own rate, and सबसे बड़ा जो प्रॉब्लम इंडिया में है कि इवन इन अ वेरी पढ़ा लिखा क्लास देयर इज वेरी लेस हेल्थ लिटरेसी. अनसर्टेनिटी इज देयर, मतलब आदमी को पता ही नहीं होता है कि वेदर ही शुड गो फॉर दिस लैब कोलिस्टेक्टमी लेप्रोस्कोपिक कराए या ओपन कराए, एंड नोबडी इज देयर टू give such kind of information ki which one is better, either robotic surgery is better or the manual surgery is there. So there is a lot of uncertainties there. That is a kind of, you can say, the knowledge gap is there between that. Okay. Third change is that growing incidences of the catastrophic expenditure. Again, this part is very important. Healthcare cost in India, it has been increased. And what is the catastrophic expenditure in terms of the healthcare? This is a very peculiar kind of word. Anywhere you go in the any kind of interview or something like that, that all question can be asked. What is the catastrophic expenditure which is considered in the healthcare? There are two things. One is the impoverishment and second is the catastrophic expenditure. इम्पॉवरिश का मतलब ये है कि आपका हेल्थ कंडीशन या आपकी फैमिली का हेल्थ कंडीशन इस तरीके से होता है कि लॉट ऑफ मनी दैट इज गोइंग टू बी स्पेंट ऑन द इंडिविजुअल. ओके, दैट इज द स्टार्ट ऑफ दिस कैटास्ट्रॉफिक, वो आपका इम्पॉवरिशमेंट है. एंड कैटास्ट्रॉफिक एक्सपेंडिचर जब हम उसको क्लासिफाई कर देते हैं, इसका 1 परसेंटेज इज देयर एग्जैक्टली. आज द परसेंटेज आई डोंट रिमेम्बर. डब्ल्यूएचओ का एक परसेंटेज है कि जब आपका हाउस होल्ड इनकम का इतना परसेंट ज्यादा खर्च हो जाए तो दैट इज कंसीडर्ड इन द कैटास्ट्रॉफिक एक्सपेंडिचर. बट फॉर अंडरस्टैंडिंग कैटास्ट्रॉफिक एक्सपेंडिचर मीन्स कि यदि आपके घर में 4 बच्चे हैं, ऑल द 4 चिल्ड्रन दे आर गोइंग टू द स्कूल, बट बिकॉज ऑफ द सिकनेस ऑफ द फादर और वन ऑफ द चिल्ड्रन, द ऑल एक्सपेंडिचर, मतलब ऑल द मनी जिस जो हम फीस में देते हैं या उनकी कॉपी किताबों पे खर्च करते हैं, वो सारा पैसा एक तरफ शिफ्ट हो जाता है. एंड उसके उस रीजन की वजह से 2 बच्चे स्कूल नहीं जा पाते हैं, उनको स्कूल से ड्रॉप आउट करना पड़ता है. तो इस लेवल पे जब आ जाता है एक्सपेंडिचर, तो डेट इज कॉल्ड कैटास्ट्रोफिक एक्सपेंडिचर. इसी तरीके से खाने में हो सकता है कि जिस घर में हम 3 टाइम खाना खाते थे, फ्रूट आता था, नॉनवेज आता था, लेकिन इस इलनेस की वजह से, क्योंकि इधर का पैसा उधर डाइवर्ट हो गया फॉर द हेल्थ केयर, तो अभी घर में फ्रूट नहीं आ पा रहा है, घर में लोग नॉनवेज नहीं खा पा रहे हैं. This is again considered as catastrophic expenditure. Or sometimes you have to sell your property, you have to sell your shop, you have to sell your land. So these are all things they are considered under the catastrophic expenditure. As a public health personnel, you must understand, you should be able to differentiate between the catastrophic expenditure and the impoverishment. And as there are two terms, one is the voluntary payment and one is the out-of-pocket expenditure. I told many times, out-of-pocket expenditure में again we are giving from the pocket, that you can say that is a voluntary expenditure. But difference is that out-of-pocket expenditure and voluntary में we take some kind of premium or some kind of insurance. आउट ऑफ पॉकेट एक्सपेंडिचर का हेल्थ केयर में या पब्लिक हेल्थ में मतलब ये है कि जब हम ट्रीटमेंट लेने जाएं उसी समय हम उसको पैसा दें। हम किसी डॉक्टर के पास गए, हमने उससे ओपीडी किया, उसने 800 रुपए की ओपीडी बताई और हमने उसे अपने 800 रुपए जेब से निकाल के दिए। तो द मोमेंट यू आर गिविंग द मनी इमीडिएटली आफ्टर गेटिंग द सर्विस, दैट इज कॉल्ड आउट ऑफ पॉकेट एक्सपेंडिचर। एंड यू मस्ट एबल टू डिफरेंशिएट दिस, क्योंकि इसकी इंपॉर्टेंस आगे जाके बहुत ज्यादा है। What is the out of pocket expenditure and what is the voluntary expenditure? Second is the rising economic growth. Again, I have told this thing कि now people's earning capacity is more, lot of avenues are there. People have more money to invest on the health. So because of that, they seek the good healthcare facilities and all that kind of thing. So that is the fourth, rising economic growth enables. So these are the four major changes which actually has been noticed in the 2017. And in preview of that, this certain NHP 2017 has been initiated or the launch. And age is that, no, aim is that or goal is that ki health well-being for all at all stages, and it should include all kind of care, preventive, promotive, rehabilitative, and all that kind of thing, and universal access to good quality care services, okay, without any kind of financial hardship. तो ये सारे जो फैक्टर्स हैं वो जो इनिशियली मैंने बताया, इक्वालिटी, एसेसिबिलिटी, एक्सेप्टेबिलिटी एंड अफोर्डेबिलिटी, वो सारी चीजों को जस्टिफाई करने की कोशिश कर रहा है अपना गोल, NHP 2007. So what are the key components of this goal? Two words has become, one is the universal health coverage, and what are the part of the, हम बहुत समय या कई बार आप ये वर्ड सुनते रहते होगे टीवी में, न्यूज में, एवरीवेयर, यूनिवर्सल हेल्थ कवरेज, यूनिवर्सल कवरेज. What are the actually universal health coverage? Universal health coverage, there are three four characteristics that is supposed to be met. That is one, वही है, इक्विटी होना चाहिए, अफोर्डेबिलिटी होना चाहिए, एसेसिबिलिटी होना चाहिए. These three important characters, they are the part of that universal health coverage. We must ensure, then only way we can think about that कि every people they will get this universal health coverage. And second part कि we should be able to reduce the catastrophic health expenditure. ये बहुत जरूरी है. वो नहीं होगा then it becomes a serious problem. Then preventive and the promotive focus, I told you, sanitation, nutrition, ये सारे important part है which are supposed to be addressed into this care. They are the part of this 2017 goal. Okay. फिर quality and affordability, this is all I have already told. Quality के लिए now we have seen कि this NQAS assessment and all that is being done. फिर alignment with sustainable development goal, there are 17 sustainable development goals, okay, and that covers the most of the area which are dealing with the human, environment, and the animals also, okay. तो उसमें SDG में जो नंबर 3 SDG है, that is particularly related with the health. So whatever the policies, public health policies, or whatever the public health programs are being made, there are SDG. It is one important concept. Sometimes we have time, so we'll talk about in the separate chapter SDGs, Sustainable Development Goal. But you must remember कि Sustainable Development Goal में there are 17 components, and out of the 17 component, number 3 component covers everything. They covers under this third component of the SDG. Second is related with the hunger, food, and all that. Okay, they're also related with the indirectly related with the health, but direct relationship with the health is the component number 3. Fifth part is that is the inclusivity and the equity. It is very important. Inclusivity means all the vulnerable group, they are also supposed to be included for this healthcare program, in a very very fair manner. No discrimination should be there. Ayush and the traditional medicine system, they are being promoted in this 2017. And one important thing is that health technology assessment and the digital health technology ecosystem in NSP 2017. It is a very important feature of this 2017. Health technology assessment is a separate subject. So I just try to summarize you. Otherwise, it is a separate subject. Sometimes I will get the chance. I will also take this lecture because I have done the course on this, certified in this health technology assessment also. हेल्थ टेक्नोलॉजी असेसमेंट बेसिकली आपको समझना है टू इंश्योर एविडेंस बेस्ड कॉस्ट इफेक्टिव इक्विटेबल एडॉप्शन ऑफ द हेल्थ टेक्नोलॉजी। एंड हेल्थ टेक्नोलॉजी का मतलब सिर्फ मशीन और इन सब चीजों से नहीं है। हेल्थ टेक्नोलॉजी असेसमेंट में जो हेल्थ टेक्नोलॉजी में आती है, उसमें दवाएं भी आती हैं, वैक्सीन्स भी आती हैं, डिवाइसेस भी आती हैं, डिवाइसेस भी आते हैं, डायग्नोस्टिक मेथड्स भी आते हैं, ट्रीटमेंट प्रोटोकॉल्स भी आते हैं, एंड इवन प्रमोटिव एक्शंस भी आते हैं। दे आर ऑल कंसीडर्ड अंडर द हेल्थ टेक्नोलॉजी। अब असेसमेंट, व्हाट इज द असेसमेंट? मींस यू हैव टू असेस कि वो जो पर्टिकुलर हेल्थ टेक्नोलॉजी यू आर गोइंग टू अडॉप्ट और द इम्प्लीमेंट, दैट इज सपोज टू बी कॉस्ट इफेक्टिव। कॉस्ट इफेक्टिव, same time it should also be accepted by the community. So these are the two things that is very important. तो यहाँ पे इन्होंने NHP 2007 में इसका इन्होंने health technology assessment with they have given a lot of thrust. There are separate body, and one of the big forgotten that place name, Coimbatore, or perhaps it may be the Coimbatore. It's a big center is there for that. Here, this is a decision making tool. Essential STA is the decision making tool when you are doing the assessment of the technology, whether it is cost effective, it is acceptable. Then you take the decision whether it has to be implemented or not, and compare it. You have to compare effectiveness and all that kind of thing. So these are the basic health technology assessment. Otherwise, it's very separate things. As I told you, cost effectiveness and technology is cost effective, but it should not. It may not be accepted by the local community. Then it is waste. Provides sufficient survival benefit to relative to its cost before including public health. मीन्स जब भी हम कोई कैंसर की दवा को सिस्टम में इंक्लूड कर रहे हैं, तो क्या जो सर्वाइवल के बेनिफिट हैं या जो क्वालिटी ऑफ लाइफ है आफ्टर यूजिंग दिस ड्रग, दैट इज हायर देन द कॉस्ट ऑफ ड्रग्स, देन दिस टेक्नोलॉजी इज गुड। Otherwise, if we are introducing the technology also, but after giving this cancer drug, even the quality of life is not improved, that technology is waste. That is not going to be accepted or the implemented. So this is actually the job of this health technology assessment. So you must understand this word also, health technology assessment. And 2017 में same thing we talk about this digital health technology ecosystem also. What is the vision of this skill digital tool जितने भी आपके e-health, m-health, AI, IoT? अच्छा, anybody can who can tell about this IoT? What is the IoT? What is the IoT? What is the IoT? Anybody can tell? Okay. IoT is
Internet of
the
Things,
internet.
maybe.
Okay. IoT is the Internet of Things. Okay. And anybody can give any example of this IoT? It's very simple. Internet of Things means the medical things or the medical device which is working through the internet. They are the Internet of Things. उसमें बहुत सारी चीजें हो गई, आपके बियरेबल गजेट्स हो गए, घड़ियां हो गई, सेंसर्स हो गए, ऑल दैट, बिकॉज दे आर कनेक्टेड विद द इंटरनेट, दे आर नोन एज द इंटरनेट ऑफ थिंग्स। दैट्स ऑल। ई हेल्थ में टेलीमेडिसिन, ये सारी चीज आ गई। एम हेल्थ में मोबाइल एप्लीकेशंस आ गए बहुत सारे। एआई इज एवरीबॉडी नोज व्हाट इज द एआई, predictive AI, generative AI, lot of things are there. And purpose of this technology is assess efficiency and the quality of healthcare delivery. So the digital health technology ecosystem, that is also the key feature of this national health policy 2017, and link public and private health record, electronic health record. That is again a very hot topic now. Everybody is talking about that. Okay, and Aadhaar card use and all that. They are all meant for this. Talking about telemedicine, remote consultation, now facilities, Ayushman Center pe, CSC pe, PSC pe, everywhere it is like that. And Asha worker, they are also given some app on the mobile, that is the M Health. they are they are entering the data, कितने लोगों को वैक्सीन लगाई है, कितना मैंने एंटीनेटल चेकअप किया है, तो आशा वर्कर दे आर ऑल डूइंग दैट। And big data analytics also, because government has given the portal also for the entire country, and everybody is supposed to enter the data of the TB, diabetes, or hypertension. So that is a very big data. Why it is big data? Because it's aggregate the whole data of the whenever some policies are being made. And these data also help as a AI predictive tools. As I told you, AI generative, maybe predictive. So if all this data is there, you can guess the outbreak surveillance, personalized treatment, or you can guess about some kind of infection and all that. Ayushman integration, Ayush services, they're also integrated, and all the facility level. Now it is mandatory, yoga hona chahiye, all that kind of thing hona chahiye. That is the all thing. And now this is the last slide for today: synergy between the STA and the digital health. One thing is that STA informs the digital adoption, health technology assessment that evaluates the cost benefit of the technology, and digital health क्या enable करता है? They provide the data and all that, and based on the data, this health technology assessment they are being done. So that is why they work in the synergy. And what are the challenges? Fragmented systems in interoperability, ठीक है, high cost prioritization via the STA, अर्बन रूरल डिवाइड, मीन्स जो रिमोट एरिया है वहाँ पे हेल्थ केयर फैसिलिटी नहीं है, तो वहाँ पे एम हेल्थ के थ्रू पहुंचने की कोशिश की जाती है. एंड टिल डेट व्हाट आर द स्टेटस ऑफ दिस digitalization or that kind of thing? So you know this Ayushman Bharat Digital Mission, that has also been started. This CDCO being what I told you, STA being health technology assessment being, that is also being established by the India. These national health policies, they are very, very comprehensive kind of roadmap, and their aim is to provide equitable, affordable, and the accessible quality healthcare to all citizens. And until unless you are not able to provide such kind of primary healthcare or such kind of treatment, you are not able to achieve this universal health coverage. You are not able to achieve treatment health for all kind of concept. So this policy is just not a for the goal or something like that, for the vision only. This increase or enhance the public health, and ultimately the increase or the improved public health, they are going to be increase the productivity of the population. And further, if the productivity of the population is increased, country's economic growth is also going to be increased, and further the healthcare system or healthcare facility, that is also going to be, in terms of that is also going to be increased. That is all with this national health policy. In brief, I tried to cover that. These topics are very, very lengthy, but I tried to cover in that manner. Otherwise, if you want to read more, you can consult your textbook. And our next topic is again, it's going to be very important.